Hi, pet parents. In this video, we're going to be talking about apocrine gland anal sac adenocarcinoma. That is obviously a mouthful, so we're going to be calling it AGASACA for short. Hi, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home. One way in which we do this is by producing this channel. So if you give us a like and hit the subscribe button, you'll be paying it forward to one of the millions of Americans who do not have easy access to veterinary oncology. I hope that this channel brings them the information that they need to make informed decisions for their family members. Now, there's never any sugarcoating this. Cancer sucks, but there is a little bit of hope. There's a lot we can do now to help dogs with all types of cancer, including AGASACA. So let's get into it. So what is AGASACA? Well, it's a tumor or a cancer that forms from the apocrine glands inside the anal sac. Your dog has two little anal sacs on each side of his or her anus, and they produce scent to sort of mark the area and say who was here. Unfortunately, just like any body part, it can develop a cancer. Sometimes it's just in one of the anal sacs, and sometimes it's in both of them. So how would you know if your dog might have this problem? The clinical signs are a little bit nonspecific. You could see a little lump or a big mass in that area. Your dog could be scooting around or licking back there a lot. That usually means something's irritating them back there. It might be difficult for them to pass stool. They might try and either nothing comes out, or sometimes it comes out kind of squished like a little ribbon. And sometimes they are very thirsty and drinking a ton and peeing a ton because of something referred to as a paraneoplastic syndrome, something that comes alongside the cancer, and that is hypercalcemia, or an elevated calcium level that makes you very thirsty, and the more you drink, the more you pee. But none of these signs are specific to this tumor type. They're associated with this tumor type, but having a bump back there doesn't automatically mean the pet has cancer. And just because the pet is scooting also doesn't mean they definitely have cancer. So how do we go about diagnosing the problem? You're first going to start with a visit to your veterinarian. They're going to do a rectal exam, and they're probably going to feel this lump. A lot of veterinarians will then do what's referred to as a fine needle aspirate. So they'll put a small needle into the lump and extract some of the cells out, put that on a slide, and send that to a pathologist. And I would say probably about 85% of the time, if there's cancer, we're able to diagnose it with that test. Sometimes all we see is inflammation. That doesn't necessarily mean that's all that's there. So if we see sort of just inflammation, then the veterinarian will probably prescribe antibiotics, assuming that the anal gland has been infected and that's why it's inflamed, and maybe some anti-inflammatory drugs. If the problem goes away, great. If it doesn't, then it needs to be biopsied. And by biopsied, I mean the anal gland needs to be removed. Now, once we know that a pet has been diagnosed with this type of cancer, we're going to want to stage the cancer. Staging means we use a few tests to determine how extensive is this cancer. Is it just in the anal gland, or is it also in the lymph nodes? Is it in the liver? Is it in the lungs? Is it somewhere else? Is it in the bone? The most common way that we do this is with an abdominal ultrasound and chest x-rays. Unfortunately, it's pretty common to see this tumor metastasize or travel to the lymph nodes that live underneath the spine. So we've got our diagnosis and we've got our staging. So how do we go about treating this type of cancer? Our first line of defense is surgery. Definitely, if there's only one tumor in the anal gland, we would want to remove that. If the tumor has spread to the local lymph nodes, it can be beneficial for the patient to remove those lymph nodes if possible. it's not always possible. Removing the primary tumor plus the lymph nodes can really help the patient survive for a longer time than had we not removed the lymph nodes. The surgery isn't necessarily easy, and sometimes it's not possible if the lymph nodes are sort of intertwined and stuck to and invading into the local vessels in that area or blood vessels in that area. And if the tumor has spread beyond the lymph nodes, it's pretty unusual for a big surgery to help that patient. Another treatment option is radiation therapy. Radiation therapy can be quite effective at either temporarily shrinking the tumor or tumors or slowing down the progression of the cancer, which will help the patient feel better. But just like with all our other treatment options, there are pros and cons to radiation therapy and obstacles for this particular one. One of the benefits of radiation therapy, I just mentioned, it can be effective. So check. One of the downsides to radiation therapy is that it's just not accessible to most families. Unlike surgery and medical oncology, radiation therapy requires a special machine that is housed in a special type of room and requires personnel with certain skills that not everybody possesses. So, where I live in Washington State, about an hour and a half south of Seattle, the closest places to offer radiation therapy are, 2.5 hours south of me, about 6 hours east at Washington State University, and then Victoria, Canada, which requires about a 3 hour drive and a 2 hour ferry ride. So that's obstacle number one, location. Obstacle number two for a lot of families is that, in order for radiation to be safe and effective, it often needs to be delivered in multiple small doses over time. That could be anywhere from 4 treatments in 2 weeks or 16 treatments over the course of 4 weeks. It depends on the tumor type, it depends on the patient, it depends on the radiation oncologist, it depends on what type of machine they have. So most families don't consider radiation therapy an option, even though it's a medical option. A third, probably more accessible option or options are a variety of medications that could potentially halt the tumor growth, potentially shrink the tumors for some period of time. That period of time is different for every patient, and which medication is going to be effective is also a little bit different for every patient. Now, there are a handful of drugs that are potentially effective against AGASACA, but each tumor is different and each patient is different. So even though you can put, 2 dogs next to each other, they could both be 10-year-old female spayed German Shepherds, they both have AGASACA. If you remove that tumor and analyze it genetically, you are probably going to find a different genetic profile in each tumor, even though morphologically they look exactly the same. This is just one of the reasons why cancer is so difficult to treat. So this dog's AGASACA might respond to a drug called melphalan, and this dog's AGASACA might respond to a drug called toceranib. And there are a handful of other drugs that could also potentially be effective. So how do I choose who's going to get which drug? Sometimes it's trial and error. If a family can afford it, we will request a genetic analysis of the tumor. That test basically gives me a genetic profile of this particular tumor, which could narrow down the number of drugs that are potentially effective. Sometimes that test reveals that I shouldn't be using an oral medication, that maybe an IV chemotherapy drug is going to be more effective. Sometimes it says toceranib is probably not going to be effective here, but a drug called lapatinib will be effective. It all depends on which mutations are present. Now, the tricky thing is even though this test has significantly change the way we treat cancer in dogs, it's not the end all be all, and it's not perfect, just like any other test we would run. For example, sometimes we get that test back and it says, yep, this dog has this genetic mutation that says that a drug called rapamycin should be effective here. And we give the rapamycin and it doesn't work, but it had the genetic profile that said it should work. So sometimes that does happen. You might say, okay, well, why run the genetic profile in the first place? And I would argue that the more information I have about the cancer, then the probability of me picking the right drug goes up. Again, it's not perfect. We're dealing with probabilities, not black and whites. Now, the number one question I get asked when I bring up chemotherapy or these oral medications that are referred to as targeted therapy is this going to make my dog sick? I don't want to make my dog sick. I don't want my dog to be in pain. I don't want him to be vomiting every day. And my answer is the same every time. In the majority of cases, at the doses that we use in veterinary medicine and the schedules that we use in veterinary medicine, both chemotherapy and targeted therapy, which are just two categories of drugs that treat cancer, are usually well tolerated. So in veterinary oncology, we do not accept a decline in quality of life in order to gain quantity on the other end. If we do have a patient, and there's about 20% of them that have negative side effects to their drugs, we're going to change the plan. I certainly am going to change the plan. Maybe all I have to do is lower the dose a little bit. Maybe instead of giving it every day, we should try every other day. Maybe we should switch out one drug for another. Just because they can't tolerate drug A doesn't mean that they won't tolerate drug B. And in some cases, we just stop altogether. We try a couple things, it didn't work out, and that's that. My point is, there are a lot of ways to change the plan to make sure we are maximizing quality of life, not quantity. Okay, those are the direct ways that we treat cancer: surgery, radiation therapy, chemotherapy, and targeted therapy. By direct, I mean we're going directly for the tumor. We're removing it, we're irradiating it, we're giving drugs that target those particular cells to try to destroy them or at least keep them from growing. There are other ways to support the patient while they're going through therapy or dealing with this particular cancer. The first thing to think about would be to assess the patient's pain level. Are they uncomfortable? Is this a little tiny tumor inside the abdominal cavity that we know is cancer but doesn't seem to be causing any problem? Or is this a large tumor that's compressing nerves and causing pain in the back and down the legs? Or is this tumor causing an elevated calcium level, which AGASACA can do? An elevated calcium level leads to increased thirst, increased urination, kidney failure, nausea, vomiting, poor appetite. It can even lead to seizures if it's left untreated. So we assess the patient for any of that. In terms of pain relief, there are a lot of ways to decrease pain: prescription medications, non-steroidal anti-inflammatory drugs, opioids, neuropathic pain relievers. And again, just like with cancer therapy, sometimes one works and another doesn't. Sometimes you really need a combination of medications. It's always a little bit of trial and error to see what's going to work for a particular patient. There are also a number of ways to maybe decrease inflammation without a prescription medication or in addition to a prescription medication. Things like adding vegetables to the diet. Vegetables have been shown to have high levels of antioxidants, a compound called sulforaphane. Even the fiber in vegetables will feed the beneficial bacteria in the gut, which is 20% of your immune system. So adding things like broccoli, cauliflower, carrots, or whatever vegetables they'll eat to the meal each day will also strengthen the immune system. Anything we can do to strengthen the immune system while a patient is battling cancer, I think is going to be helpful. Another way to decrease inflammation without a prescription medication is with a CBD supplement. I have a whole video about CBD. It is kind of its own topic. CBD has been shown to decrease inflammation for some patients in some situations. There are a lot of different formulations of CBD, so I encourage you to watch that video so that you can pick a product that is most likely to be beneficial. And then another thing that I often talk to families about is a mushroom supplement. So there are certain types of mushrooms that have been shown to not only decrease inflammation, but potentially promote certain cells of the immune system to start attacking cancer cells. So for dogs that will tolerate the addition of like a mushroom powder on their food, or if families don't mind giving another capsule, I will also recommend a mushroom supplement to douse the fire of that inflammation. Now, if I have a patient with an elevated calcium level, there are a variety of drugs that could get that calcium level to come down. There's an IV medication called Soligernate. This is not special to oncology. General practitioners can give this. Steroid, prednisone, low doses. I know people have a lot of opinions about steroids, and I'm one of them. They definitely have their pros and cons. Or a diuretic could help that calcium level come down. And again, elevated calcium levels can be quite dangerous, sometimes even more dangerous in the short term than the cancer is to the patient. So we want to make sure we're monitoring those calcium levels in dogs with AGASACA because it's a common issue for them. And then the final thing that we worry about for dogs with this tumor type is their ability to pass stool. Sometimes the tumors are so large that it's very difficult for the pet to go to the bathroom. Something simple like adding moisture to the food, to whatever they're eating, could help. We don't want these patients to get dehydrated. Or giving a stool softener to make it much easier for that to pass when the patient has to go. And understandably, the probably next most common question that I get asked is, well, what's the prognosis? How long is my pet going to live? That's a difficult question to answer. It really depends on the stage of the cancer and which treatment option was chosen, and essentially, is that treatment effective? So if I have a pet with an anal gland adenocarcinoma that's 2 millimeters or even a centimeter, but hasn't spread to any other location and it's surgically removed, chances are it's not a guarantee, but many of those patients go on to either live out their natural lives, or maybe even with no additional therapy, they live a very comfortable life for another 12, 18, even up to 24 months before we see evidence of that cancer coming back. And then I have other patients who have an anal gland tumor that has spread to the local lymph nodes. Those patients are a little bit more challenging to treat. The more cancer that's present in general with any tumor type, the harder it is to get under control. But if the primary tumor and the lymph nodes can be removed and we follow up with some kind of therapy, whether it's radiation, chemotherapy, or targeted therapy, we could still see a survival time of anywhere from 8 to 18 months, potentially even longer, though typically once we see metastasis, expecting a survival time of more than a year is a little unrealistic, though it does happen. And then if I have a patient with an AGASACA who's got a primary tumor that's spread to local lymph nodes and is in the liver and is in a bone, that patient is very, very difficult to treat. It's very difficult to get their pain under control for longer than a few weeks. It's not impossible, and it's not impossible to find a medication to help that patient. However, as I mentioned a little while ago, there's a little bit of trial and error that happens with many patients, not just with AGASACA. So if I have a tumor that is fast moving and widespread, and I don't pick the exact right drug the first time, well, now I've given the cancer even more time to spread. And again, the more cancer that's present, the more difficult it is to get under control. So let's say I have that patient and I give them melphalan and it doesn't work. I need about 2, 3, 4 weeks to figure out if that drug is going to work. And if it hasn't, well, now the tumor is even further spread. And so now maybe I pick toceranib, and toceranib does work. We start to see some of the cancer shrink, but it's growing so fast. The drug just doesn't have time to squash the growth faster than the tumor is progressing. So that, of course, is a very sad situation for all of us to be in. Now, I hope one of the things that you've gathered from this video is that every patient is different. Even if you have 10 patients in a room and they all have the same tumor type, they're all a little bit different and they're all probably going to respond a little bit differently, and they all have their own uniqueness to them, not only in how their tumors respond, but how are they going to the clinic? Can they tolerate going to see a veterinarian on a regular basis? Are they totally impossible to give pills to? Can they not tolerate anti-inflammatory drugs? Every patient is unique. Every situation is unique. So if you do live near a veterinary oncologist, I encourage you to make an appointment for a consultation. That consultation does not commit you to any one treatment or another, or treatment at all. But I do think you will probably find that information very valuable to you. And if you're one of the millions of Americans who do not have easy access to veterinary oncology, you can reach out to me or one of the other virtual oncologists out there to get some more information specifically about your pet. And the other thing you can do is you can ask your general practitioner, your local veterinarian, if it's okay to reach out to me. I and other virtual oncologists out there do provide cancer care plans for pets that do not have access to veterinary oncology in any other way. Now, if you found this information useful, please give us a like. It helps us to continue to offer free information to pet owners out there who do not have access to veterinary oncology. Thanks for listening. Again, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home.